The objective of this research are to be able to identify the roles of nurse as nurse leader, identify how the nurse become a patient advocate. From the given scenario, at the end of this research, we can identify and exemplify a nurse leader as a patient advocate. But first, we must identify what is nurse leaders. Competent and engaged practice of nurse who provide exemplary care, think critically and independently, inform their practice with evidence, delegate and take charge appropriately, advocate for patients and communities, insist on participating to their full and legal scope, and push the boundaries of practice to innovate new levels. This definition is given by the Canadian Nurse Association Position Statement on Nursing Leadership 2009. And it is also said that the nurse leaders are not only focuses on the management of the nurse team, but also can function as patient advocate by making sure that the interest of the patient is being protected. And now, we can now give the definition of nurse leaders as patient advocate. Helping patients reach decision about their healthcare, representing patients when they cannot represent themselves, monitoring quality of care, informing patients of their rights, and ensuring patients' rights are respected. This is the definition given by Abrams, 1978-1990. And as a nurse leader, it can help patient in her decision about healthcare by giving them the opportunity to decide based on the given list of care options that the patient can decide upon based on the needs and the resources that is present. Nurse leader can guide them. In the case a patient was unable to represent themselves, a nurse can act upon by simply taking the independent nursing action that can improve and aid the treatment. The concerns on the patient's rights, informing the patient's their rights and ensuring patient's rights is respected is also a task of nurse leader. Can work hand in hand in patient and nurse by ensuring the patient rights is observed at all times. Making sure that the quality of care is received by patient by simply making certain that all the matrix is in providing quality health care has been met through data collection and analyzing, as well as the necessary improvement if needed. And now, at a certain point, the definition of nurse leader and nurse leader as patient advocate has been given, it has been discussed. We can now proceed with the case scenario. A 70-year-old patient who is admitted in a geriatric unit due to uncontrolled diabetes and hypertension. He is also diagnosed with early onset of Alzheimer's. Patient is single and no other relative. He is living with Jim, who is cousin's nephew. During the nurse assessment to patient, it is noticed that the patient has bruise on the arms. And upon asking of the nurse to patient about the bruise, mood changes and guarding action is observed. Patient just mentioned it is from a fall. Based on the given case, a nurse leader can be a patient advocate by the following actions. The nurse discusses the disease process to the patient including a possible complication and how to manage it. The nurse also should communicate to the patient with care and support. Trust should be gained. The nurse assess the patient holistically and collaborate with other healthcare team for the patient to receive the correct treatment. The nurse should observe the possible abuse and should talk to the patient and report it to the right authority per policy's protocol. The nurse also, together with other team, collaborates to offer the best health treatment option for the patient, including the proper referrals and living situation. For further information, these are the references that has been used to this research. Abrams, 1990, A Country Review of Nurse-Patient Advocate. Canadian Nurses Association, 2009, Nursing Leadership Position Statement. And Sanchez-Whitman, 1997, The Nurse and Patient. It is Fiduciary Advocacy Relationship, Journal of Nursing Law.